The diagnosis of cancer by a pathologist is one of the lesser known and understood practices of medicine. It is important to understand what happens to a biopsy after it is taken and why high-quality pathology services are important. Specializing in anatomic pathology and specialty clinical testing, ProPath is a private laboratory and medical practice located in Dallas-Fort Worth, Texas.
ProPath started off as a hospital practice of 5 pathologists in 1966. We since have evolved into a multi-specialty practice in which we cover almost all the areas of expertise necessary in pathology. And we now have 35 pathologists and serve areas even beyond the Southwest to most states in the country.
Diagnosis of skin cancer and other conditions is an art that requires years of special training. We chose our pathologists based on reputation and board certification in the field.
During the procedure, the specimen is placed into a vial. The vial is then placed into a specimen transport bag. And it is here that the journey of a biopsy begins.
We've developed a 14 checkpoint barcoding system that follows a patient's specimen all the way through the process, with the goal of getting the right results for the right specimen back to the right patient. We've all heard the horror stories of surgeries on the wrong people, or when no surgery was needed, or on the wrong body part. We've worked hard to build a system that minimizes the risk of these kinds of mistakes.
With difficult and unusual cases, multiple pathologists confer and repeat slide interpretation to improve accuracy of diagnosis.
When a patient has a blood test, it's analyzed by an instrument in a laboratory. But when they have a biopsy, a slide has to be prepared and has to be examined by a pathologist. The result is no better than the technologist who prepares the slide and the pathologist who examines the slide. It all comes down to training and experience. The better a pathologist's training and the more experience that the pathologist has, the better the result. Also, it has to do with the amount of time spent examining the slide. In dermatopathology, we examine every slide twice to ensure that we've seen everything.
Through our academic affiliation with UT Southwestern Medical School, we have a very active learning environment for both pathology and dermatology residents. We feel it's important to stress the importance of accuracy, but also patient-centered pathology, because at the end of every biopsy, there's an anxious patient awaiting a right result.
Well, the teaching at ProPath really is exceptional. We get a lot of individualized one-on-one attention with a lot of different dermatopathologists. And plus, ProPath has a really large volume that goes through here. So we have an opportunity to see a lot of different cases. And that really makes a difference in our learning.
It's our role as pathologists to provide timely and accurate biopsy results. This can help alleviate the patient's anxiety and also facilitates proper management of the patient. I believe that we should treat every specimen as a person and not just as a number or a piece of tissue.
Recruited from top academic institutes such as Duke, Johns Hopkins, and the Mayo Clinic, ProPath's team of more than 35 board-certified pathologists has subspecialty training and expertise in a number of areas.
The pathologist is the most important part of the process. The expertise in the mind, behind the eyes, behind the microscope is the most important requirement for a good diagnosis. But then you have to surround that expert pathologist with the right tools and technologies and technical staff to prepare the specimen and deliver the results. One reason we take this process so seriously is that we regularly are our own patients. My grandmother's breast biopsy came through this practice, then my 19-year-old niece's skin biopsy, and then recently my own from a routine colonoscopy. All 3 of these encounters resulted in surgeries. Regardless of who the patient is, there's someone out there wanting to know if they have cancer or if they have a health issue. We will continue to analyze our processes and invest the resources to do everything we can to get this right. It's that important.